these 3 new conditions you must inform TFL. A. Flu. B. Diabetes. C. High blood pressure. Correct answer is B. Diabetes. C. High blood pressure. Before the start of each journey, your operator is required to record what information? A. Date and time of booking. B. Customer name, pickup and destination. C. Customer hobbies. Correct answer is date and time of booking. B. Customer name, pickup and destination. Who is responsible for setting fare before the journey starts? A. TFL. B. PHV driver chose himself. C. Your operator. Correct answer is A. TFL. What should you do if a passenger decides to change the destination? A. Get cash for the difference. B. Ask passenger to get out of the car. C. Contact your operator and wait for updated fare instructions. Correct answer is C. Contact your operator and wait for updated fare instructions. When can a driver refuse to take passenger? A. They are very happy. B. They talk too much. C. Carrying open bottles or cans. Correct answer is C. Carrying open bottles or cans. If you have a passenger using wheelchair, you can A. Charge extra fare for additional time you need to attend them. B. Cannot charge extra fare. C. Ask for cash only. Correct answer is B. Cannot charge extra fare. If you cannot reduce the risk of violence. A. Get away from the aggressive person and exit the situation. B. Tell customer that you will stop the journey if they don't calm down. C. Drive fast so you can end the journey as soon as possible. Correct answer is get away from the aggressive person and exit the situation. PHVs on double yellow lines are allowed to A. Drop off and pick up passengers. B. Wait for passengers. C. Never allowed to stop at all. Correct answer is drop off and pick up passengers. PHVs are allowed to stop on the red route. A. Only between 2200 hours and 6 o'clock HRS when waiting no longer than 5 minutes. B. Allowed. C. Strictly not allowed. Correct answer is only between 2200 hours and 6 o'clock HRS when waiting no longer than 5 minutes. Who are vulnerable road users? A. Pedestrians, cyclists, motorcyclists. B. Buses, cyclists, children. C. Trams, lorries, vans. Correct answer is pedestrians, cyclists, motorcyclists. A PHV driver can get exemption for carrying assistance dogs when A. Medical reasons. B. Religious reasons. C. It makes car dirty for next passenger. Correct answer is medical reasons. How can you reduce problems with ride sharing? A. If a passenger complains, just stop and drop them. B. Take cash for additional passengers. C. Confirm with each separate passenger that they booked rideshare when picking up. Correct answer is C. Confirm with each separate passenger that they booked rideshare when picking up. From what age, PHV drivers must have a medical examination each time they apply to renew their license? A. 45. B. 65. C. 75. Correct answer is 45. Who can give out penalty charge notices, PCNs? A. Only the police. B. On-street parking attendants or enforcement officers. C. Privately hired street wardens. Correct answer is B. On-street parking attendants or enforcement officers. Who has the power to set or control the fares charged by PHV operators? London's taxi service. B. Individual PHV operators. C. TFL. Correct answer is B. Individual PHV operators. Who should you ask? If your passenger disagrees with the fare or is unable to pay it at the end of the journey. A. Your operator. B. Check the TFL PHV handbook. C. Your passenger must always pay the full and correct amount. Correct answer is your operator. To get your license to be a PHV driver, you must be medically fit. The standards you must meet are the DVLA Group 2 medical standards. In most cases, this will mean that you will need to have a medical examination with someone, i.e., a doctor, who has access to your full medical records. You may be exempt from supplying a medical form if you A. Have a full or provisional, issued after January 1997, DVLA Group 2 license. B. You have some disability. C. Member of EU country and have medical from EU. Correct answer is have a full or provisional, issued after January 1997, DVLA Group 2 license. 30. PHV licenses last for how many years? And the vehicle must have another licensing inspection before a new license can be issued. A. 3. B. 1. C. 3.5 years. Correct answer is B. 1. 31. As a London PHV driver, you can only carry out bookings that you have received from A. London PHV operator. B. Licensed London PHV operator. C. PHV operator. Correct answer is B. Licensed London PHV operator. 32. TFL's website has a license checker too. L, which contains the details of all licensed. Choose 2 correct. A. Private hire drivers. B. Vehicles. C. Families. Correct answer is private hire drivers. B. Vehicles. 33. The section Staying Safe looks at how to keep you and your passengers safe. It covers A. Driver safety. B. Drugs and alcohol. C. The license discs are very costly. Correct answer is driver safety. B. Drugs and alcohol. 34. All ride-sharing journeys must be booked with A. PHV operator. B. Licensed London PHV operator. C. London PHV operator. Correct answer is B. Licensed London PHV operator. Please read the following information carefully and answer the question below. 35. To get a license you will need to take a separate test to check your ability to select and plan a route, read a map and identify locations. The test is held in a center approved by TFL and conducted under exam conditions by a TFL examiner. This test is known as a topographical skills assessment. You will need to prove that you have at least a B1 level of ability in the English language. B1 is a level of English in the Common European Framework of Reference for Languages, CFR. Which one of the following statements is correct? A. You will not need to prove that you have at least a B1 level of ability in the English language. B. B2 is a level of English in the CFR. C. The test is held in a center approved by TFL. Correct answer is C. The test is held in a center approved by TFL. Please read the following information carefully and answer the question below. Be ready to give disabled and older passengers some help. This could be as simple as writing things down for them, giving them a little extra time, facing them so they can see your lips as you speak, or speaking loudly and clearly if they have problems hearing you. Which one of the following statements is correct? A. PHV drivers should assist disabled and older passengers by speaking in a different language. B. PHV drivers should assist disabled and older passengers by providing help, such as writing things down or speaking clearly. C. PHV drivers should assist disabled and older passengers by asking them to sit in the front seat. Correct answer is B. PHV drivers should assist disabled and older passengers by providing help such as writing things down or speaking clearly.